Hello everyone, my name is Dr. Timale. Today we're going to talk about antidepressants. Major depression definition: a mental health disorder characterized by persistently depressed mood or loss of interest in activities, causing significant impairment in daily life. Possible causes include a combination of biological, psychological, and social sources of distress. Symptoms: most patients with depression appear normal. At least 5 of these symptoms should be present during the same 2 weeks. Depressed mood, loss of interest or pleasure, loss of appetite, or significant weight loss. Sleep disturbance, psychomotor agitation or retardation, feelings of worthlessness, fatigue or loss of energy, diminished ability to think or concentrate, recurrent suicidal thinking. Pathophysiology: MDD is associated with disturbance in the CNS serotonin, 5-HT, activity. Other neurotransmitters implicated: dopamine, DA, norepinephrine, NE, glutamate and brain-derived neurotrophic factor, BDNF. Pathophysiology: a depressed state is associated with decreased metabolic activity in neocortical structures and increased metabolic activity in limbic structures. Medications: 12 weeks at a therapeutic dose. Treatment failures often caused by non-compliance, inadequate duration of therapy, inadequate dosing. Treatment should be altered if the patient does not have adequate response in 6-8 weeks. Treatment should be continued for 4-9 months in a patient with a first episode, longer maintenance periods in those who have had 2 or more episodes. The choice of drug or treatment modality should be guided by clinical assessment, presence of other disorders. Stressors: patient preference, reactions to previous treatment. Drugs used for the treatment of depression: selective serotonin reuptake inhibitors, SSRIs, serotonin norepinephrine reuptake inhibitors, SNRIs. Atypical antidepressants: serotonin dopamine activity modulators, SDAMs, tricyclic antidepressants, TCAs, St. John's wort. SRIs: they block the reuptake of serotonin, which increases the amount present in the synapse and magnifies its effects. SSRI examples are citalopram, escitalopram, Lexamil, fluoxetine, Prozac, fluvoxamine, Luvox, paroxetine, Paxil, sertraline, Zoloft, vilazodone, Vibrid, vortioxetine, Brintellix. Accessory advantages of SSRIs: ease of dosing, low toxicity and overdose. Other features of SSRIs: drugs of choice in children and adolescents. First-line medications in late-onset depression. SSRI adverse effects of SSRIs: these include gastrointestinal upset, sexual dysfunction, changes in energy levels, that is, fatigue or restlessness. SNRI examples: venlafaxine, Venlor, devenlafaxine, Pristique, duloxetine /Cymbalata /Yalade levomilnacipran, Fetsima. Major depression: SNRIs block the reuptake of both serotonin and norepinephrine into the presynaptic neuron. They do this by binding to the reuptake transporter and preventing the transporter from doing its work. This increases the levels of serotonin and norepinephrine in the synaptic cleft. Examples of atypical antidepressants include mirtazapine, bupropion, trazodone, nefazodone, tianeptine, and agomelatine. Atypical antidepressants' mechanism of action is poorly understood. They do possess serotonergic properties. They also affect dopamine and norepinephrine levels in the synaptic cleft. They are used in patients who have intolerable side effects to SSRIs, used as first-line treatment if the drug has desirable characteristics. For example, bupropion decreases nicotine cravings, and mirtazapine does not interfere with sexual function. Tricyclic antidepressants, TCAs, include amitriptyline, triptanol, clomipramine, anafranil, and imipramine tofranil. These are very toxic in overdose. Side effects of tricyclic antidepressants include dizziness, drowsiness, blurred vision, dry mouth, tachycardia, racing heartbeat, constipation, and sweating. St. John's wort, or Hypericum perforatum, is used for mild to moderate depression. It acts as an SSRI. The dosage is 300 mg TDS. If there is no response after 6 months, change to a different drug. Electroconvulsive therapy, ECT, is a way of inducing a seizure that disrupts severe depression. It works by neural rewiring and boosts neurogenesis, generating neurons from neural stem cells. Indications for ECT include the need for rapid antidepressant response, high risk of suicide, failure of drug therapies, history of good response to ECT, patient preference, and high risk of medical morbidity and mortality. Additional therapies for depression include bright light therapy, BLT, transcranial magnetic stimulation, TMS, vagal nerve stimulation, VNS, and deep brain stimulation, DBS. Bipolar disorder has 2 types: depression mania and depression hypomania. Medications used for bipolar disorder include benzodiazepines for acute agitation, anti-manic agents, anticonvulsants, first-generation antipsychotics, and second-generation antipsychotics. Treatment for manic episodes requires hospitalization, usually involuntary admission. Mood stabilizers are the mainstay of treatment. Examples of mood stabilizers include lithium, carbamazepine, lamotrigine, and valproic acid. Lithium is the preferred drug for long-term stabilization. Carbamazepine is effective in terminating mania. Valproic acid is effective in treating mania. Lamotrigine is effective in treating bipolar depression. Antipsychotics are used to treat mania and psychosis associated with mania. Lithium, first-line treatment for mania, reduces severity and frequency of mania. May also have an effect on bipolar depression. Lithium is effective in reducing risk of suicide. Mechanism of action, first used for mental health in 1948. Unknown mechanism. Thought to decrease norepinephrine release and increase serotonin synthesis. Lithium increases the lifespan of neurons. Side effects include upper limb tremor, diabetes insipidus, increased thirst, hypothyroidism, lithium toxicity, diarrhea, tinnitus, carbamazepine, Tegretol, second-line treatment in bipolar disorder. Tegretol and an anticonvulsant. Also used to treat neuropathic pain due to damage of the somatosensory nervous system. Side effects include suicidal thinking, decreased bone marrow function, skin rashes, confusion. Valproic acid/epilim is an anticonvulsant also used to treat migraines. Mechanism of action unclear. Side effects include increased suicide risk, dry mouth, nausea, and vomiting. Drowsiness, lamotrigine/lamictin. Lamictin is an anticonvulsant used to treat bipolar depression. Antidepressants are not recommended to treat bipolar depression. Side effects: Stevens-Johnson syndrome, suicidal thinking, blurred vision, vivid dreams or nightmares, leukopenia, decreased white cell count. We have come to our conclusion. Let us put to test to the topic we just did now, antidepressants.